everyone, my name is Aaliyah Gelati and I'm a poultry product specialist with Ralco. Today I'm going to be walking you through how to perform a necropsy on a chicken, specifically a laying hen today. And when you look at your flock and maybe something's a little off, a necropsy can really help uncover what might be going on that you might not be able to observe on the surface. Say you have a dip in production, or maybe your intake is a bit down. Performing a necropsy is a relatively easy way to figure out what might be going on and what steps you might want to take moving forward to help either fix or mitigate future problems. So to start off with a necropsy, the first thing you want to do is actually just observe the bird. Observe, them in their natural environment. What are they doing? What's their behavior? Are they, depressed? Are they up and walking around? Their behavior can tell you quite a bit before you even touch a bird. And speaking of, birds in their environment, it's very important that you also, before you start the necropsy, make sure that you're capturing your data, keeping production records, and looking at any types of trends or say a dip in feed consumption or water intake, because data can tell you a lot as well before you even have to touch a bird. So it's important to keep really, thorough records and share those with a vet, or if you have technical support such as what Ralco can provide, it really helps us to paint a fuller picture of what's going on. Starting to look at the bird itself, the first thing I do is start kind of around the head. Think head, shoulders, knees, and toes. Kind of start from the top and work your way down. Looking at the head of the bird. Look at its comb and its wattles. What's the color? What does it feel like? It should be pretty pink like this one is. Firm, not dehydrated, and free of any lesions or any type of mites, any kind of external parasite, because the head and the face is a location where you can see external parasites pretty easily. And then take a look at the eyes. They should be pretty clear. If they're cloudy or maybe swollen, that can mean there's something respiratory going on, as well as if there's any kind of nasal discharge or mucus coming out of the nasal cavities. That can also mean respiratory. The head of the bird is a really good place to identify respiratory challenges the quickest. So you can also open up the bird's mouth and specifically look for any type of necrosis or lesions, because that is a sign of mycotoxin contamination of the feed. And speaking of feed, that's another thing that could help with identifying what's wrong with your birds. Make sure you're sharing the feed information with whoever you're using as support, because that can help them diagnose and come up with a plan. So looking at the head and neck, obviously I mentioned swelling. Everything should be pretty consistent in color, no big lesions, but also look at the feather cover. So feather cover on this bird is obviously very, very consistent, but feather cover can indicate a few different issues, maybe pecking, cannibalism, like that. So let you see this side as well. Feather cover is a big one. Just overall, how does the bird look? And then we can move on to the vent or the cloaca. Look at the vent area, and it's another area where you can see external parasites. But also you can tell if the bird is in lay here. So you just take a few fingers and you can palpate right between its pubic bones and tell if the bird is laying. So this one, I can fit about 3 fingers between, and you can feel them pretty prominently. So if you can fit about 3 fingers in between, the bird is probably laying, and this one is. I can fit 3 fingers, so that means that the bird is actively laying eggs. And you can also kind of look for any, if it's very dirty around the vent area, it could mean that the bird has, runny feces and potentially a gastrointestinal type of issue. And you can also, like I mentioned, see external parasites in this area as well. And then looking down at the legs of the bird, again, another area where you can see some external parasites like mites. Look at the leg and just the scales in general. the closer and kind of the more almost saran wrapped the scales are to the skin, the more that bird is dehydrated. So you can tell kind of if the bird has been drinking water. You can look at the bottom of the feet and see if there's any kind of irritation or signs of bumblefoot, for example. But overall, just, you know, does it look normal? And that's the big thing that we're going to discuss today, is what's normal, because normal doesn't necessarily look the same for every producer, but it should be relatively similar, and anything that's abnormal should warrant your or pique your interest, and maybe consider having someone come out to support you and check on some birds, maybe post a few and kind of give you some insight as to what's going on. However, what I'm going to try to do today is help you to be able to do that necropsy yourself and get some, you know, initial findings, so you have some background information to give either a veterinarian or technical support or a consultant, whoever you're using to help you manage your flock. The last thing I did want to mention is the underside of the wings and this kind of shoulder area right here. If the bird has certain respiratory issues, it can have, like I mentioned earlier, a runny mucus type or discharge out of its nasal cavities. And what the bird will do is actually use its shoulder to kind of wipe, or its elbow, whatever you want to call it, but it'll use the top of its wing to kind of wipe at that discharge. So sometimes you'll be able to see, you know, some dried mucus, or just it looks like dried liquid kind of built up right in this area. But underneath the bird, you can also, it is an area where you can see any type of, you know, again, external parasites, because again, you can kind of see the skin pretty easily here in the wing web. And this is also the area where you will get, for example, wing web vaccinations. So that's a pretty comprehensive list of what I personally look at when I'm looking at a bird before I actually perform the necropsy, looking externally just at the overall health and behavior of the bird. Because again, there are a lot of signs and symptoms that you can observe from the outside before you actually dive into the necropsy itself. Now that we've covered that, let's take a look at the inside. All right, so the first thing that is kind of an optional step, but it's really good practice during a necropsy, is to dip the bird in some soapy water, or you can use a disinfectant and water. And that really helps to just kind of keep the feathers down, so you're not, you know, covered in them. And once you kind of start to open up the bird, things get a little sticky. So in order to help with that and keep things clean, dipping the bird in a solution not only helps keeping the feathers down and out of your way, but it does also help kill off any type of pathogen that the bird might have externally. So it's pretty simple. A bucket with either soapy water or water and disinfectant. Soapy water might be a little better, but you can, you know, make do with what you have. And even if it's just you only have water, necropsies in general are a very, you know, easy DIY. Make do with what you have. It doesn't need to be fancy. You don't need to have a bunch of different equipment. I've done this with kitchen shears before, and that was all I had. So you can really do this with whatever you have available. So basically just what you do, dip the bird into the water, and if you're not getting, you know, water kind of in the areas where there's a lot of feathers, you can just kind of make sure that you're moving some of those feathers back, getting water down in it. And since this isn't soapy water, it is a little bit harder to get into these cracks. And then once you finish, you can simply actually pull the bird out. I'm going to try to get as little water everywhere as I can. You can lay a towel down or just put it on the table. For this, I'm gonna put the towel down just so I can get it a little bit more cleaned up so you can see it a little better. I don't want feathers and water flying everywhere. All right. And you can also use the same solution if you need to clean equipment as you go and just kind of rinse off any feathers that do come off or any, coagulated blood, anything like that. So now that we have the bird here, it's been dipped, I'm gonna walk through a couple of different things that I like to look at externally that are a little easier to do when the bird is dead before I actually start cutting into the body cavity. So starting at the top, looking externally, you can open the bird's mouth. And here is where I was mentioning earlier that you can see, lesions or mainly what looks like necrosis of the tissues. And that is a very common indicator of a mycotoxin challenge. So just opening the mouth and looking around in there. You can also, while you're up here, look at the comb and the wattles if there were any sort of lesions that you might want to get a closer look at. Here's another area where you can tell if there is potentially a mycotoxin challenge. You can get some necrosis up here. And then you can also open the eyes and look at the eyes a little closer. Are they clear, cloudy? Is there any swelling? You can look at the nasal cavity, any mucus or discharge there, and also inspect a little closer. You can see now why the water was so important. You can really tell, kind of see closer to the skin and inspect for any external parasites. And then once you finish with the head, what I also like to do is just feel the keel bone, and this can kind of, we're gonna open it anyway, but you can feel for any sort of deviation here. And again, if you wanted to get a closer look at your wing webs, you can look for that here. You can feel, I like to kind of feel for any bone abnormalities, if there's any breakage, if you have a bird that might be, walking weird, you can check the leg bones, kind of feel here. And that will be a little easier once we cut the bird open, but I still like to feel just in case there's anything that I notice on the outside. And the next big thing externally is going to be the hock joint. So you can feel here, is it swollen? That is a pretty good indication of some kind of gait challenge. Feel the hock. If it feels good, should be ready to move on to the internal necropsy, which we are now going to move to. So like I mentioned earlier, I typically like to start from the top of the bird and work my way down. So I mentioned, looking inside of the mouth to see if there's any signs of necrosis or, irritation. But you can also cut into the mouth and look into the esophagus and the trachea. So to do that, you stick your scissors right between the beak, and you might feel some resistance. That's normal. I might turn it this way so you can see it a little easier without my arm in your way. Cut down the side. And try to, again, be careful because you can cut through the esophagus. Then you can open it up and see this is the bird's mouth and it's going down. And this is now the esophagus. And this is where obviously the food is going to be passing through. It's the same thing as your throat. It goes down. You can look for any sort of bruising, any irritation, and again, any, type of lesion here. But this looks, smooth, pink. And also just be careful that you're not, because there is quite a bit of blood here. It is coagulated, and it coagulates pretty quickly, but Still be mindful that just because something might look red, you know, it could just be blood. So feel free to, you know, just wipe, make sure it's not something more serious. So that is your esophagus. And then if you can see right here, this is the entrance to the trachea. So what you can do is simply stick your scissors in as so and cut. And there is a membrane here, so it is very slick. I'm trying to make sure you can see, but cut down the trachea. And you can go as far down as you want. I don't usually go too far down. But you can open up the trachea and look at the inside membrane, see if there's anything, you know, does it look like there's any irritation? Sometimes, you know, barns are sometimes high in ammonia, dust levels, so any respiratory distress could potentially be seen in the trachea. Just because there's nothing here, just because it looks pretty clear, does not mean that there's not, you know, a challenge present, a respiratory challenge present, but it's just something to consider, that not all of these symptoms that I'm describing need to be present for a challenge to be present. So that is the trachea. Before we start the internal necropsy, sometimes what I like to do, especially when there's a lot of feathers in the area right below the keel bone, is just kind of pluck a few feathers off to make it a little easier. You can toss them in a compost bin or just in the trash. And then the next thing, which I just did on accident, but what you're gonna do to open the body cavity is take a pair of scissors, and you can feel right below the keel bone, kind of pinch the skin and make a small incision right below into the skin. And you want to make sure it's a little bit deep, because there are membranes and things that you could run into, and you want to make sure you're getting past that initial layer of skin. So once you do that, a lot of the time, what you can do is just get up underneath the skin. This one ripped a little weird, but you can just pull it back. And this is again why having some kind of dip is beneficial, because there are many feathers. So once you have the bird open, you can obviously see the breast muscles and the keel bone a lot clearer. And when we're looking at the breast muscles, think of the boneless, skinless chicken breasts that you buy at the grocery store. It should look very, very similar. Obviously, they're going to be a lot smaller on a laying hen, because that's not what these birds are, you know, bred for. But it should be the same principle. Think of what you buy at the grocery store. It should look very similar. If there are any type of lesions, any kind of red spots or white striping, for example, that might be something such as white striping or woody breast. And here, for example, you can see there is a small red lesion in this area. Not necessarily anything to be concerned about right away, but it's something to take note of, because even if there are small things while you're cutting this bird open, keeping them in mind and maybe having someone write them down and keeping track of them can help you to identify bigger challenges, because sometimes small things build up, and it's just beneficial to have all of your notes together. So if you are looking at a certain disease that maybe has very similar clinical signs to a different disease, looking through your list can help you differentiate. Maybe there's one thing that this challenge shows versus this one, and that can help you identify tentatively a little better what's going on. So the next thing I like to do, just to make this a little easier for myself, is to separate or break the legs. So take your hands right on top of the leg bones here and just pop open, and you should hear them pop. I'm not sure if this picked it up, but you should feel two very obvious pops, and that will be the dislocation of those joints. Again, some of these steps are optional, but once you practice more, it becomes kind of second nature. But for now, I'm going to cut some of this membrane back so you can see the body cavity a little better, so that I can more clearly show you what I'm doing. So after you've made your observations here, you can also take a look at the skin on top. Sometimes you can see certain lesions, kind of dermatitis type issues. But now what we're going to do, I'm going to make an incision again at the same place, right below the keel bone. And this time you should be able to cut a little down until you feel ribs. And you can even cut into the ribs a little bit, and that will make the body cavity easier to open. And then we will do the same on the other side, making sure you can see. And again, it does not have to be perfect. I have done this several times, and it doesn't really, matter how accurate you are with cuts, as long as you're not cutting into any type of organ that you're not ready to look at yet. So now that we have this cavity open, you can obviously see the liver. And I did want to point out though, although your cuts don't need to be perfect, and if you cut into something, that's okay, you still want to be really careful because, for example, underneath the liver is the gallbladder, and that is filled with a green fluid that can really, if you cut it open, become messy inside here, and it can hinder your ability to see certain organs or certain issues. So just making sure that we're being mindful of things like that. So looking at the liver in this bird, it's a little pale. Your liver should be a dark red color, and a homogeneous color. So in order to look further than the liver, we can now cut the liver out. And in order to do that, I'm gonna actually crack this open a little bit more, if you can see now. Be very careful to go underneath and cut where the liver meets the membrane. And again, there are several times where I will just pull the liver out, but again, it just depends on your familiarity and the experience. Once you do this a few times, it really does kind of become second nature. So again, like I mentioned, I'm being very careful around the gallbladder because I do not want a bunch of green liquid to come out. Cut on the side. And now you can see the spleen. So the spleen is going to be also underneath the liver. And you can cut right between. And now you can, observe a little better. If you wanted a close-up, you can see the gallbladder, which I will not be cutting open because I do not want to be green. But you can also make a cross-section cut, and you can observe the inside of that liver as so. You can just set that aside, throw it in a trash can. So what I'm going to do next is point out the lungs to you. So if you can see this pink spongy tissue here, this is going to be your lung, and I can try to get a piece out for you real quick. A lot of the times what people will do is take a piece of lung with rib. It's just a little easier. You can just make an incision between the ribs and cut down almost like you're taking a little square out of the ribs. And I know it is a little hard to see. I'm trying to make sure that you all can see this pretty well. So the pink tissue here again is the lung, and it should be pink like this, and it should be pretty squishy, no, you know, clear fluid or anything like that coming out. And that can again be a sign of a respiratory issue. You could also see air sacs throughout here, and that again, you want them to be clear, not cloudy. And also back here, you can see the heart. It will be covered by a membrane, and you can just pop it out, and then snip it off just like that. And you can see it with this heart, there is quite a bit of fatty tissue. There shouldn't really be that much, but this bird, as you can see down here, has a relatively large fat pad. And as I mentioned, the liver was a little pale and almost yellowish. So it's, you know, this is not to be unexpected when you do have a bird with a fat pad that large. And what some people will also do, you can actually cut into the heart and look at the chambers. There's a lot of fat, so it is very slick. And one thing to note also, right after you call the bird, a lot of the times the heart will look like it is still beating. The bird is not alive. It's just a response that the muscles have post-mortem. So again, you can look inside the heart at the chambers, look at the muscle. Again, the heart is pumping blood to the entire body, so it should be a pretty muscular organ. You can throw that aside. So one other thing, and I need to pull this back. You can look at the crop of the bird as well. So oftentimes when you have a bird, maybe you just pick it up in the barn, you can feel its crop kind of around the neck area and see if that bird has been on feed pretty easily. But it is something that you can also look at inside the bird. So basically at the top of the breast muscle, just pull the skin back a little bit more, and if you need to make some incisions in the skin to help it pull back a little easier, that is fine. But you can identify the crop here on the left side. Again, there's quite a bit of fat up here, but this organ here is going to be your crop. And again, you can feel and see if it is full of feed. If it's not, again, you don't have to open the bird to tell if the crop is full. You can just palpate it externally. But I did want to point it out here because it is something that now that the bird is, open and we're looking at certain organs, I wanted to point this out because you can cut it open and examine what the bird has been eating. So once you cut open the crop, you can see obviously feed material, and you can also, look and see if the bird has been eating any grass or litter or anything it shouldn't be, because that can lead to impaction in the digestive tract and cause some issues. So feel around, look and see what it's been eating. You can even just scoop some out and just look through it. Looks like there's a lot of feed, not really much litter that I'm seeing, maybe a few little pieces, but it looks like what the bird just ate. And that's the goal in the crop because it hasn't digested anything yet. So it should look very similar to the feed that you're putting out for the bird. And the next thing I wanted to point out is you can see the proventriculus here, and you can see the gizzard to an extent. Now again, there is quite a bit of fat in this bird, so I'm gonna try my best to get through some of that so you can see it a little better. Now, even with a bird that does not have as much fat as this, you do still have to make one more incision to get to the actual intestines themselves. So they are inside kind of a deeper cavity. So you just take a little pinch here, cut into it, and again, shouldn't be all this fat here. In a typical bird, maybe some backyard flocks will have birds that have a larger fat pad. So it's not, you know, detrimental, but it is something, again, to just make note of. So once you cut into the cavity, you can see, first of all, the small and large intestines, mostly small, and this is going to be your duodenal loop, and then this organ that runs through it in the middle is going to be your pancreas. So what I'm going to do for you is walk you through kind of top to bottom what organs are in this body cavity and in the digestive tract of this bird. So again, here you can be as careful as you want. I usually just rip everything out, but with a bird like this, you can really tell when you look at the mesentery membrane, this is a lot of fat present. All of the cloudy yellowish tissue is not normal. And again, what we're looking for is any deviations from normal, so something to make note of. So I'm just going to start pulling some of these out. And at the top of the small intestine is going to be this duodenal loop. So when you start pulling, just keep in mind that the duodenal loop is going to be connected to your gizzard here. So you're going to want to pull the opposite direction of that, and you will eventually reach the cecal pouches. Thank you. So now that I have the intestinal tract out of the bird, before I get into these specific organs in depth, I'm going to remove some of this fat so it is a little easier to see. And again, this is optional. If you don't have as much fat, you don't need to be doing this, but it should peel right off. And now you can start to see the gizzard a little better. And the proventriculus. So what I like to do typically is I go to the top of the proventriculus and I make an incision right at the top where it meets the esophagus. And now we have the proventriculus attached to the gizzard, attached to the duodenal loop and the jejunum and ileum. And then once we reach the end, we obviously have the cecal pouches and the large intestine down here. So I will now kind of dive into each of these a little bit more individually and show you what I do to look at them. So starting off with the gizzard and the proventriculus, I usually cut the proventriculus off of the gizzard first and just examine it, look at it from the outside. It shouldn't have any big red spots or lesions or anything like that. And the same for the inside. It should not have any super, abnormal looking spots or any type of, bruising. We can just wipe this off a bit. This is a pretty normal looking proventriculus. Again, pretty consistent color. If it looks healthy, it typically usually is. And there's no redness, no swelling, nothing that looks abnormal. So we can say that this is a pretty good proventriculus and move on to the gizzard. So with the gizzard, I also detach this. So what you want to do is go to the junction between the small intestine or the duodenal loop and the gizzard and just make a cut. Again, does not have to be perfect. And just inspect the outside of the gizzard. Again, this one's pretty fatty, but it should be a pretty dark red and very muscular organ, because this is where you're getting that mechanical digestion. You always hear about, putting grit or oyster shells, something of that matter into a bird's diet, and this is why. This is where that mechanical digestion is happening. And this is the grinding organ. So it's going to be very muscular and very firm. So you can also then cut into that. And I just stick one end of my scissors into the opening at the top or the bottom, depending on which way you look at it. And basically just take a cross section like so. And then you can open up the gizzard. You are going to see what looks like little pebbles. That's normal again. And a very large, section of muscle like this. Again, it's a muscular organ. It is grinding the feed. So this is completely normal. And we can scoop this out real quick and look at the actual inside. And again, if you still have that bucket of water, disinfectant, soapy water, you can also use that to kind of rinse this off. But I don't think that is super necessary for now, because you can see, it looks a pretty consistent yellow. There's no obvious, lesions or hemorrhaging, anything like that. So I would say this is a pretty normal gizzard. But again, that's why we're here, to kind of show you what to look for, and depending on what we find, show you what's normal, because you obviously don't know what you're going to find until you open up the bird. So moving on, we have the duodenal loop, and again, this does have the pancreas running down the middle. So if you pinch this, you can actually just peel back and you can detach that. And again, any type of hemorrhaging or bruising, just keep note of. So now the duodenal loop. When we get into intestines, a big part of looking at the gut health of a bird and the digestive tract is looking not only on the outside but on the inside. So obviously I've been cutting up cross sections of these organs to look inside, but that becomes especially important when you're looking at the intestinal tract. So what I like to do is take a good middle section of each different section of the intestinal tract. So this is going to be my middle section of the duodenal loop. And you just kind of cut off the ends and you can just throw them aside. But get you a relatively good section, because not all challenges are going to be present throughout the entire intestine. So you could very well miss something if you're not getting a good sample. And then you just go through and it should open up right like that. And this is a location where you can see, red spots pretty easily, or sometimes you can see circles. And really, like our nutritionists say, spots on animals, unless you're, a cheetah, are not normal. So anything that looks basically not like this might be something that you need to look at a little further. And here I can actually see something. I'm going to cut here, and it looks like it is just a piece of grit potentially. But again, just make note of any sort of abnormalities that you find, such as this, because again, when you get further down the line and maybe have a professional come out and help you look, it could be something that maybe you just thought it was a piece of grit like I did, but it could be something else, and you might need a professional to come and help you with that. And identify whatever that could be. All right, so after you finish looking at the tissue within the duodenal loop, the next part is going to be to identify where your Meckel's diverticulum is. And this is going to separate the jejunum and the ileum. So follow the intestine down and look for just a little nodule, and it is going to look almost like a piece of fatty tissue, but it is where the yolk is attached to the intestine, And you can just make a cut right at the diverticulum, and now you have your jejunum and your ileum separated. So again, take a pretty sizable sample of the middle. We love a representative sample. And before you maybe cut it, just kind of look across the intestine while you're looking for that Meckel's diverticulum and see if you can see any type of hemorrhaging or bruising or abnormalities on the outside of the intestine. And you can see there's fluid coming out. If it helps, you can squeeze it out. I am, for the time being, just so you can kind of see what it's going to look like, cut right down the middle. And it really helps if you have a pair of blunt scissors like so, and that way you're not cutting the inside of the intestine as you're cutting into it. You're just making one clean cut. And after you finish that, you can just lay it out and again look for any type of bruising, lesions. You can identify worms as well pretty easily in the intestine. And any type of lesions or bruising can indicate an issue such as maybe coccidiosis, or you might, see necrotic enteritis. But I'm not going to get into every single challenge that you can identify because that would take quite a while. So I'm going to move on to ileum. And what I'm going to do here, just for ease, and to show you the ceca separately, I'm going to separate the ceca from the rest of the small intestine. And you can see here, the ceca are the two pouches at the end of the small intestine where fermentation happens. So what you want to do is just cut right at the end. Take yourself a nice representative sample after, checking, making sure everything looks normal. You can just toss them to the side. And you'll notice the inside, the digesta, becomes a little thicker as you move down, and that's because the small intestine is extracting moisture. So it's forming more and more of what you think of when you see fecal material as it moves down the digestive tract. And right away, just to point out something for you, whenever I cut this end open, I'm not sure if you can see, but there is something pointing out in the digesta here. So that's just something to maybe look a little closer at, because again, worms are pretty common, especially when you have birds that are cage free or free range, have outdoor access. You can pretty easily see worms sticking out of digestive material. So this is not moving, so I'm not sure that that's what it is, but it's something to make note of. So again, what I'm going to do is make a cut right down the middle. Open it up and just look. Look at the digesta. Look at the thickness. Is it bloody? Is it runny? And that can kind of tell you, a few different things as well. And then what you can do is just basically scrape it out, and that allows you to see the inside of the intestinal tract. And again, it's pretty clear. It is a very pale pink. I don't see any sort of lesions or any kind of, hemorrhaging, any red spots or circles or anything like that. So, this looks pretty normal to me, but since we did see this small object, I'm going to cut further in. And that, when you see something that might be abnormal, it may warrant you looking a little further into whatever it is that you're examining. So I am going to cut all the way through this just to see and make sure, because there are certain worms that live in different parts of the intestinal tract. So for example, cecal worms are going to be little small worms in your ceca. You can have tapeworms that mainly live more in the small intestine area, but just kind of look and see. You can do some scraping and see if there's anything in here of concern. I don't see anything, so again, that makes me think that it's not worms, especially since they're not moving, because most of the time you'll be able to tell. So I'm going to toss that to the side. And the next thing I'm going to look at is the ceca. I'm only going to cut open one for the time being. So looking at the cecal pouch here, what I like to do is find the large intestine, which is the remaining portion after the cecal pouches, all the way down to the cloaca or the vent, and just make a cut. With the cecal pouches, a lot of the time the part where it meets the large intestine is a little smaller, so what I will do is go up a little bit higher and make an incision here. And then same thing. Go in and just make yourself a little cut. And now we can see the inside of the ceca. And this part is often going to be darker than the rest of the digestive and the small intestine, and that is completely normal. And you can also see it when you are looking at the floor of, say, your barn. You might see droppings that are lighter color or darker color. Keep in mind, you know, what the digestive inside of the ceca looks like, because the bird will expel this a few times a day. So if you're seeing a darker stool or feces on the ground of your barn, it does not always mean that something's wrong. That just might be a cecal, you know, dropping. So don't always be alarmed, but again, just make note of it. And if you're not certain, obviously you can have a professional come out and take a look, or even just snap a picture. It's pretty easy for most things for, you know, a vet to look at it through a picture and see this might be this issue or this might be this issue, and even, you know, ask for different pictures if they see something that might lead them to think of a certain issue. They can request more information from you. So again, you can just scrape this back as well and look at the inside. Are there any, again, lesions, any type of hemorrhaging, anything that, you know, red spots that doesn't look normal. So if you want, you can now cut the other ceca off, and you can do the same thing with the large intestine. Basically go as close to the vent as you can. And this is where the digestive tract meets the outside of the bird. So it is one large portion. So go as close to the vent, the cloaca, as you can, and make an incision to cut the large intestine. Again, you can just make a small incision, look inside. This is really where the digestive should look like the fecal material that you're seeing on the floor of your barn. So if there's anything abnormal in the feces that you're seeing on the ground, you should be able to also observe it here if there is feces present. Now, if the bird had just defecated, it might be a little harder because there might not be anything here, but you can still observe the inside tissue and kind of scrape it back. You know, it looks pretty clean to me. It looks like a pretty consistent color. No major, you know, red flags there. So now what I wanted to point out is going to be your reproductive tract. So looking at the reproductive tract, you'll see all of these orange yellow follicles, and these are going to be your egg yolks. Now, you can also tell if a bird is not in lay yet because these will not be present. You will not have all of these big yellow developing follicles. And you can pull this out very carefully. And the reason I'm going to be so careful right now is because there is an egg forming. So you can also pull out the reproductive tract, but with this bird specifically, you can see here that there is a large egg forming. However, you can tell that it is still soft. The eggshell has not been calcified, so it is going to be very fragile and can break very easily. So instead of just yanking it out willy-nilly, I am going to make sure I cut the membrane very gently. Because I do not want this to pop inside the body cavity, because that will be a mess. All right, so this is where the follicle is going to enter and then travel down to form what you see in the grocery store, an egg. And the further down it goes, the more it looks like an egg. So this one still has a ways to go, but you can sort of see past the membrane that there is a follicle, or now, you know, a yolk in there. And it also does have the albumin surrounding it. And if you want to, you know, inspect the reproductive tract, you can do the same thing, open it up and look, but I'm not going to cut open the entire thing. What I am going to do is show you if, you know, you have an issue with eggs, or if you're just curious to see what it looks like. You can open, and I might need to make a little bigger hole. Just gently squeeze it out. Look familiar? Scrambled eggs. There is another thing that you may observe in a laying hen, and that is any signs of the bird being an internal layer, or, you know, oophorytis or peritonitis. It will be relatively obvious. There's going to be, you know, signs of an egg that maybe didn't get laid. What happens is the egg drops inside of the abdominal cavity, and you'll get an egg that is outside of the reproductive tract. So that can cause issues. A common cause of that can be E. coli, so it could be something to note. But I do want to point out just how many follicles that there are. Each of these follicles will one day become an egg yolk that will then be laid into an egg, and you can just pull one off, look at it. I mean, it's pretty fun, even if, you know, there's nothing wrong with it. And then wanted to point out down here, below the reproductive tract, you can see the kidneys, which are, hopefully you can see, going to be these two red globular structures here. And let me see if I can cut them out relatively neatly. I don't usually cut kidneys out, but it could be helpful if there's anything specific that you're looking for. But typically just looking at them, you know, visually observing them from the outside is enough. For me personally anyway, everyone has kind of their own way of doing necropsies, and I did unfortunately cut into one of them, but you can see it should be a pretty homogeneous color, darker red, almost like the heart, and there shouldn't be any sort of lesions or discoloring or anything like that. So another thing I just thought of actually that you can do is you can take a cross section of the breast muscle if you see any type of white striping, or, you know, any type of lesion or redness, blood spots, and, you know, take a sample, send off to the vet. And that goes for anything here really that your vet can use to identify challenges with. They might want a certain section of the intestinal tract, or even, you know, a leg. Sometimes they want a bigger part of the bird that they can then use themselves to kind of cut down and get exactly what part they need for a specific test to identify a challenge. So All right, so that concludes our necropsy tutorial. I do hope that this helps boost your confidence to perform one of these for yourself in the field. Again, it's not a complicated process. It's relatively easy once you get the hang of it, and I do hope that this helped guide you through the process. Thank you so much for being here with us and joining. Our contact information will be here in case you have any questions. Please feel free to reach out, and we're happy to help answer any of those or fill in any gaps that we missed. So thank you again, and have a good one.